Okay, I got the gloves on. Let's get the vitals fast before they wake up. And oh my goodness, I do apologize. Did I wake you? You've been awake a little bit in and out? Okay. Do you know what's going on where you are? I'll give you a quick rundown. My name is Nurse CECE. I'm taking care of you this evening and into the night. And you're here in Dream City Clinic because you walked into the emergency room. You said your throat was feeling a bit bad. And we give you a check. We had a little bit of a surgery where we removed some of your tonsils. And then we did a little laparoscopic cut right there to make sure everything was good. And we're going to give you a quick head-to-toe exam as fast as possible. Is that cool with you? Good. We make sure these are fast so that we get the complete look around you, and we can double check in the morning to see if you're doing well, okay? So, may I touch your face? Good. We're first going to check right where the sutures were right there. It's only right there, and if you've been healing well, we can actually remove that little stitch today. Isn't that exciting? Good. How are you feeling on a scale of 1 to 10? 1 being the best, 10 being the worst? Okay, I'm going to just put a little bit of pressure on your lymph nodes. Is that okay? Good. I'm going to make sure this is as fast as possible so you can sleep and recover well, okay? Okay, look at the light for me. Good. I'm going to shine that right there. You don't have to talk much. In fact, you can just relax. I know that it's been a bit of a difficult time. Okay, a little bit of swelling here. Let's check the other side. And with this lymph node, it seems that you're fine. Okay, I'm going to quickly check your eyes for some sort of nystagmus or sometimes sleepy eyes from anesthesia. Okay, it's going to be a bit faster than usual. Do you think you can keep up? Good. Look at the light over here. Good. And can you look at the light over here? Good. Okay. And can you tell me, is light above or below? Is it above your peripheral vision or below? Good. Is the light above your peripheral vision or below? Very good. Okay. I'm going to get a little bit closer now. I apologize. We're just going to take a look at your eyes. We always double check. Good. And the other one. Good. We're double checking. Good. I'm going to ask you to say ah for me. I'm going to hold a little bit of the side here. Say ah for me. Good. Okay. It looks like everything is healing well there in the back. I'm going to get a little bit closer. Good, okay, and you can relax. Okay, I'm going to put my hands on your lymph nodes very fast. I'm going to ask you to do something a bit uncomfortable for me, okay? Do you think you can just swallow like that? Very difficult, I know. It's a little bit painful. We'll give you some medicine for that. Okay, very good. You tried your best, okay? Next, what I'm going to do is I'm going to take a quick look with a separatory light. Okay, can you follow the light here? Follow it over here. Follow it below. Follow it over here. Okay, just follow my instructions. Super easy. Can you look all the way over here for me? Good. Can you look over here for me? Good. Can you look over here for me? And can you look over here? Okay, quick questions for you. It's going to be a bit faster again. Is this the right side that the light is shining on? Your peripheral vision from your direction. Is this left or right for you? Good. This is, yes, left side. Is this left or right for you? From your peripheral vision, what is that, left or right? Good, that's right. Okay. Is this light in the center of your peripheral vision, or is it off to a side? Okay, center is here. Where would light be? Is it the center or to the side? Okay, here's the center of your peripheral vision. And is light to the center or to the side? Very good. Okay, it seems like your eyes are working super well. That's good for me to know. Now what I'm going to do is I'm going to get your temperature, if that's okay with you. Good. I'm just going to get a little temperature gauge. Okay. I'm going to ask you to breathe in and breathe out. I'm going to put this on your forehead. It's a bit cold because it is metal. 3, 2, 1. Good. And one more. We're going to check your temperature to the other side. 3, 2, 1, and okay, good. It looks like your temperature is average and usual. Do you feel extra cold or extra warm right now? Okay, and do you feel like you're unnecessarily cold? Maybe have shivers? Okay, because we're looking for several types of things, which could be cold, fever, that could mean infection or irritation. So anything you have to settle that down. Now I'm going to get your heartbeat, okay? Do you feel like your heartbeat's beating really slow? That's sometimes what happens with anesthesia. Okay, It's going to be a little cold. I'll heat it up a little bit, okay? Okay, I'm going to place this on either side. Just want you to breathe in and breathe out. Okay, breathe in, breathe out. Good. Good. Okay, other side. So again, a little cold. Breathe in, breathe out. Okay. Very good, okay? I'm going to place it on the back side of your back. We're going to listen to your lungs, okay? I'm going to ask you to breathe in, breathe out. We're listening to any types of phlegm or whatever. Just breathe in, breathe out, okay? Other side, good. Breathe in, breathe out. Other side, breathe in, breathe out. Perfect, okay. So, what I am hearing is your lungs are performing well. Do you taste iron in your mouth at all? Okay, I'm going to get a quick sample of just inside your mouth, okay? Can you say ah for me? Say ah. I'm just going to. Okay, then this side. Good, we got a sample. We're going to send that into the laboratory now. Perfect. And then we do have to double check your medicine here, okay? How's your arm feeling? Good. Okay, so what we do have is a bit of this going on. We're going to add a separatory medicine to this to make sure that you are doing okay. Okay, and good. It looks like everything is performing as it should. Good. Okay. You feeling okay? Feeling a little sleepy? That's sometimes what happens with the antibiotics. And how's your arm feeling? We have a little IV system connected to your arm. We'll clean that at the very end to make sure, but that seems to be doing a-okay, which is perfect for me. Okay, I'm going to push that to the side a little bit. What I'm going to do next is we're going to add a little bit of tests to you once more. And we did see that you may need to have your blood pressure checked. We're going to do that. Okay? So I'm going to put this around your arm as fast as possible. Just going to check your blood pressure. Just going to. And give me your other arm. Good. Are you relaxed? Good. I'm going to be listening to your blood pressure now. Okay. So, just relax. I have the gauge right there onto you, so I'll be able to see perfectly. Okay, so just breathe in and breathe out. And we're going to release a little bit of that pressure. Good. So, blood pressure is looking good. You are looking fabulous. I'm just going to carefully move a little bit up your arm now. Going to feel instant relief from that. That's amazing. Good job. And then, what I'm going to do now is I'm going to carefully just test a little bit of your eyes. We have several other tests that we always like to do just to double check that we didn't affect anything with the anesthesia. So, I have a little pen here. Okay, can you look at the Snellen's chart here? Do you know what letter that is in front of you? What letter is this one in front of you right there? That is an E. Good. We're going to move on to the fourth line here. Are you able to read any of the letters from the fourth line? What letter is that? Good. O. What letter is this? L. What letter is this? C. And what letter is this? That's F. Okay. We're going to double it down, get a little bit faster now. Okay. I'm going to ask you to name a word when I point to the letter. So, what I want you to do is look at this line right here. This is the fifth line. The first letter we have here is D. Can you give me a word that starts with the letter D? very good. Perfect answer. Diamond, dog, all those answers are perfect. Okay, we're going to move all the way on to this letter right here, which happens to be B. Any word that comes to mind when you think of B. Very good. We will accept bumblebee. Good. Okay. And blueberry too. Gonna go all the way down to the lowest letters. Can you read any of those at all? Or do you feel like your vision's a bit blurry still from the anesthesia? Okay. And what letter is this right there? Okay, that's L. Can you give me a word that starts with the letter L? Good. Love works perfectly, and so does life, and so does laugh. Live, laugh, love. And all the way to this one over here. Can you tell me what letter that is? Perfect. That's the letter H. And can you give me a word that starts with the letter H? Good. We love happy, and we also love helicopter. We're always working here. Can't explain enough how much we do work here. And I'm going to write that down very quickly. Do you feel like you'd be able to give me a couple last tests, or do you think you're a little too tired? Okay, I'll try to rush them. So, what we have is I have a series of pens here. They're all different colors, nothing too fancy of an exam, I promise, okay? And what we're going to do is, I'm going to ask you just to identify the color when I pull the pens up. Do you think you could do that for me, darling? Okay, good. And what color is this pen? Good, that's purple. Very good. What color is this pen? Green. You're doing great. What color is this pen? That's white. Perfect. What color is this pen? Blue. Amazing. What color is this pen? Orange. And then what color is this pen? This one is red. Amazing. You're doing so good. Thank you so much, by the way. I'm going to give you 2 sets of medicine now. One is an antibiotic for the throat. The next one is going to be a pain reliever, okay? This first one, I'm going to ask you just to say, ah. Okay, say ah, and you're going to get 3 drops. Okay. Now, if you can, I'm going to ask you just to attempt to just drink that medicine down. Feel right there. Good. Try your best. I know it's difficult. Good. Okay. Moving on to the next one. That one should kind of almost taste like cotton candy. A lot of people say that. I think it tastes more like some sort of Laffy Taffy. This next one is not the best flavor in my opinion, but if you like this, you like this. It's like a fruit punch. I'm going to ask you to say ah carefully, okay? We're going to add 5 drops of this, okay? Just say ah. You actually like that one. Very good. Some people say it tastes like a Taco Bell Baja Blast. I don't really relate, but I think it tastes good. So I'm gonna tell you here, just try one more time. Try and just drink that. Good. And looks like your entire exam is done. You can go back to sleep now. Looks like we changed your IV medicine. How is the IV on your hand, by the way? Is it comfortable? Okay. And do you feel like we should change it? Good. Okay. We'll be changing that in the morning, 100% then. And then we're going to ask you again, pain tolerance 1 out of 10, etc. in the morning. You can go back to sleep now. Thank you so much for allowing me to perform this fast exam. I hope you have a great rest of your night. If you need me, call button is to the right. It's the big red one. You cannot miss it. And I'll send you some pudding in a little bit. Okay. Thank you so much for being here and allowing me to examine you really fast. We really appreciate that. And have a good rest of your night. Ciao, darling.